Assalamualaikum. My name is Anam Iftikhar and my group members are Izaz, Asad and Rabia Iftikhar. The drug that is assigned to us is nitroglycerin, and let's take a look upon the pharmacodynamics, kinetics and effects of this drug.
So what is nitroglycerin and how does it work? It is also known as trinitroglycerin, nitro, or glycerol trinitrate. It is used for the treatment of angina, acute coronary artery spasms, acute myocardial infarction, and severe hypertension. It is quite effective, inexpensive, and fast-acting. Now, how does it work? Nitroglycerin in the body is converted to the enzyme nitric oxide by an enzyme mitochondrial aldehyde dehydrogenase. This nitric oxide is an active substance which activates an enzymatic synthesis of cyclic GMP. Now, this process will eventually lead to the dephosphorylation of myosin LC of smooth muscles, which causes relaxation and increased blood flow in the veins, arteries, and cardiac tissue. Now, all of this process will lead to the decreased work of the heart, decreased blood pressure, decrease in angina symptoms, and increased blood flow to myocardium. Now you must be wondering, how is it used? Nitroglycerin can be administered through many routes, mainly intravenously, sublingually, rectally, sublingual spray, or as a patch applied to the skin. It produces similar response, but each one produces different time of onset and duration. Sublingual nitroglycerin acts rapidly within the onset of 1 to 5 minutes. It lasts about 60 minutes. It avoids hepatic first-pass metabolism. Now, for other routes, the effects is slower in onset but lasts several hours. The adverse effects of nitroglycerin are usually cardiovascular in nature and rarely life-threatening. Because nitroglycerin can dilate cerebral vessels, headache is a common side effect and may be severe. Occasionally, the venous dilation caused by nitroglycerin produces reflex tachycardia. Some healthcare providers prescribe a beta-adrenergic blocker to diminish this undesirable increase in heart rate. Many of the side effects of nitroglycerin diminish after a few doses. Nitroglycerin should not be given to patients with pre-existing hypotension or with high intracranial pressure or head trauma. Drugs in this class are contraindicated in pericardial tamponade and constrictive pericarditis because the heart cannot increase cardiac output to maintain blood pressure when vasodilation occurs. Sustained release forms should not be given to patients with glaucoma because they may increase intraocular pressure. Dehydration or hypovolemia should be corrected before nitroglycerin is administered, otherwise serious hypotension may result.